Hello, my friends. It's Dr. Sharon with Clinic Reviews. Today we're going to be talking about communication, just therapeutic communication. So it's going to be pretty straightforward. It's pretty fundamental. Definitely you need to know this for the NCLEX. So let's go ahead and get started. Hello, my friends. It's Dr. Sharon with Clinic Reviews. You know, Clinic Reviews is the organization that is in charge of this YouTube channel. Mark Klimek is the GOAT of NCLEX reviews. He's been doing it for 40 plus years. You can find out more about our NCLEX online on-demand NCLEX review, 21 plus hours of recorded content by the GOAT himself, Mark Klimek. Go to clinicreviews.com. And you can also sign up for our streaming service where you get all the videos we've ever made, then put on YouTube, including the ones that have been taken down just because of their age. They're all on our streaming service. You can also meet me live via Zoom if you want to sign up for our tutoring service. So, small group tutoring. All right, let's go ahead and get started. So this is our, sorry, I was just looking to see if my dogs are around. Sometimes you guys like to see my dogs, but they're all pretty chill right now, so I don't think they're going to be very happy if I ask them to get up. They are in here with me, but all right, so these are pretty straightforward, pretty fundamental communication questions. A nurse is planning a diabetes education class for a community group. Which action should the nurse take first? Which means more than one could be something I would do. The question is, what would I do first? Arrange for handouts to be printed in English. Okay, fine. Assess the groups. Does anything about cross-cultural? Okay, assess the group's literacy level and language needs. Oh, well, that would be better to do that before I do A. Assess what time of day the clients prefer to hold the class. Maybe. I don't know. Usually we don't do that. Usually we assess what they know, sort of their readiness for learning. We don't usually assess what time of day the clients prefer to hold the class. Provide a demonstration of insulin injection. Well, that would be later. So the first thing I need to do is assess the group's literacy level and language needs. So that's what I need to do first. I always press the wrong button to start out with. Okay, there we go. That's what I would do first. All right, a nurse is teaching a newly diagnosed hypertensive client. Newly diagnosed hypertensive. Okay, the client appears distracted and states, I'm worried about losing my job. What should the nurse do first? Postpone the teaching session. Maybe. Provide written materials to read later. Maybe. Redirect the client back to the importance of learning. Probably not. Assess the client's readiness to learn. Yeah, I mean, what should I do first? So I have to assess the client's readiness to learn first, because then that'll decide whether I postpone the teaching or not, or redirect the client back to the importance of learning. Like, I have to assess the readiness to learn before I can do either A or C. I might do B depending on, their readiness to learn and any assessment I might do. So yeah, I definitely have to do that first, because the other three I might do, but I have to know what their readiness to learn is first. The nurse is caring for a client who's angry about being hospitalized. Which statement demonstrates therapeutic communication? I can see you're upset. Tell me what's bothering you. Okay, I like that. I can see you're upset. Tell me what's bothering you. Yeah, I mean, maybe sort of a command, but I could be right. Calm down or I'll have to call security. Okay, no, that's not what I would say. You shouldn't be angry. This is for your health. No, that's telling them they shouldn't be. I'm not going to tell them that. Never use the word should. Really, don't use the word should. It's sort of a bad word for therapeutic communication. Don't worry, it will all work out. Okay, that's absolutely not. So A is the only one I even came close to liking. I can see you're upset. I definitely like that. Tell me what's bothering you. I may think to myself, well, I don't know if I'd be that direct. I might say, do you mind telling me what's bothering you? Or could you share with me what's bothering you? Or you seem upset about something. Would you like to share it with me? Like, that may be better, but A is better than B, C, or D, definitely. So even if you don't love the tell me what's bothering you statement, like, it's better than any of the others. So pick the best answer, right? It's the best answer out of all the ones that are there. The nurse is preparing a community health fair presentation for older adults. Which strategy best minimizes communication barriers? Okay, so usually they don't tell us the age unless it matters in the question, right? If the age is in the question, then it must matter. So it's to older adults. Community health fair presentation, okay, minimizing communication barriers. Well, providing lengthy written pamphlets with detailed text, minimize communication barriers with older adults. I don't see how that would. I'm not saying it is bad, but I don't think it would minimize communication barriers. Speaking quickly to cover more material in less time, will that minimize communication barriers with older adults? No. Use large print visuals and allow extra time for discussion. Will that minimize communication barriers in older adults? Yes. Will assessing readiness to learn minimize communication barriers in older adults? No, that's just assessing readiness to learn is fine, but it's not going to minimize communication barriers. Okay, so communication barriers are things like they can't see as well, they can't hear as well, they're emotionally distressed, something like that, right? So C is really the only one that overcomes communication barriers. A client with cancer begins to cry during teaching about chemotherapy, which is the most therapeutic response. Now this is therapeutic. I want you to notice the last one says minimizes communication barriers. So that I have to focus on communication barriers. Here I need to focus on therapeutic response. So what is most therapeutic? Most therapeutic in general, okay, it doesn't tell us the patient has a comorbidity. Well, they do have cancer, but they don't have a diagnosis that would necessarily prevent them from learning, or that I have to communicate with them a specific way. So whenever I see the word therapeutic response, I usually think what is going to encourage them to talk about how they're feeling. So therapeutic communication is usually, in general, encouraging them to talk about their communication. Now, there's at least one question coming up where that's slightly different, but in this case, we're looking for what will encourage them to talk about how they're feeling. Don't cry, everything will be okay. That's not encouraging them to talk about how they feel. This must be very difficult for you. I'll stay with you. That's empathetic, and it may encourage them to talk, just therapeutic presence. We can continue the teaching when you're ready. That doesn't encourage them to talk. I'll get you some tissues and step out. That definitely doesn't encourage them to continue to talk. So it seems like C isn't very, C isn't necessarily wrong to say, but I wouldn't say it's necessarily empathetic. And B is quite empathetic, which is also therapeutic in this setting. So I would prefer, like if I were writing, I did write the question, but if I were like specifically saying what is most therapeutic out of all possible answers, then I would say this must be very difficult for you. Can you share with me how you're feeling, right? Encouraging them to talk to me. In this case, it doesn't necessarily say encourage them to talk to me, but it's still the most therapeutic out of all the options there because it's demonstrating therapeutic presence and empathy. A nurse is developing an educational presentation for migrant farm workers who primarily speak Spanish. Which intervention best reduces communication barriers? Okay, educational presentation for those who speak Spanish. Which intervention best reduces communication barriers? Provide Spanish language handouts. That's a good idea. Provide an interpreter. Okay, I have to do that. If I'm just going out myself, non-nurse, just talking to people who don't speak English, I guess I don't have to provide an interpreter. But I'm working as a nurse, and civil law actually says that we have to provide an interpreter for people who don't speak the language. So I do have to provide an interpreter. Focus on visual aids, maybe. Simplify medical terms. Well, that's not going to help if they don't speak English, although it may help if I did it in Spanish or had an interpreter. So C and D are okay, but only if I have an interpreter. So is it better to have Spanish language handouts, or is it better to have an interpreter? Well, I have to have an interpreter, y'all. I may not even have any handouts. I may just, because it's a presentation, right? So I mean, certainly it seems like I would have handouts, but if it's a verbal presentation, I have to have an interpreter. So that's really best in this case. A nurse is planning a smoking cessation class for adolescents. Which teaching strategy is most effective? Okay, smoking cessation class for adolescents. So for adolescents, what do I know about teaching adolescents? Well, I know that adolescents, starting at age 12, we can really teach them like an adult because they can understand cause and effect. and they can think abstractly. So starting at age 12, there's no really things I can't do as far as teaching them. Smoking cessation. Okay, peer-led discussions and interactive media. So is that good for adolescents? Well, they're certainly all about peers. And certainly they like interactive media. So those seem appropriate for adolescents. Clearly present the risks of smoking using a lecture style. Is lecture style best for adolescents? Probably not. Probably not best. It's fine. If that was the only option, I could do it, but I don't think it's as good as peer-led discussions and interactive media. Ask students to come prepared to present statistics. Okay, that doesn't seem like the best thing. Ask parents to attend for improved reinforcement at home. No, we're not going to ask parents to attend because we want the kids to be able to speak freely. So this question seems to really be about, do you understand what's important to adolescents? And adolescents are teenagers generally. Usually adolescents are like 12, 13, 14, 15, 16, somewhere in there. And according to Piaget, adolescents, starting at age 12, they can think abstractly. So there's really no limit on what we can do. So you can do peer-led discussions with adolescents. So that's not an issue. And we also know from development that peer group association is very, very important in ages 12 to 18. Like peer group association is very, very important. So peer group discussions or peer-led discussions would be really good actually in this. And then interactive media just keeps them interested. And they're very, they all know how to use media. A nurse is teaching a client with new onset heart failure. Okay, new onset heart failure. The client states, I'll never be able to understand all these medications. Okay, I can understand that. What is the best response? It's not as difficult as you think. That's sort of downplaying their concern. Let's review one medication at a time together. Okay, that's like saying, here's a plan. Okay, you feel overwhelmed, but here's a plan. Let's review one medication at a time together. That's fine. If you prefer, I can teach your daughter. Well, no, it doesn't say there's any reason why they can't learn it. They're just kind of overwhelmed. We can skip the teaching if it makes you anxious. No, we cannot skip the teaching. No, let's put a plan together. So the best thing to do is to review one medication at a time together, because that's sort of saying, okay, if it said, I hear you, or you seem overwhelmed, let's review this one medication at a time, I would like that answer better, right? If it said, you seem overwhelmed, let's just review one medication at a time. Like that's a really good answer. So that answer is not there, but B is there, which is really close to what I would want to do. So if the answer you want is not there, you pick the answer closest to it. And so I would love to see some kind of a acknowledgement of how they're feeling, right? I'll never be able to understand all these meds. It would be better if we had some kind of acknowledgement of how they feel, like you seem overwhelmed. But it's not there, and it's not there in any of them. So then I have to pick B. Which client statement indicates a barrier to learning? I prefer written material to take home. Okay, that's not a barrier, that's just a preference. Please explain the side effects again. Okay, they want to hear it again, but it doesn't specifically say there's a barrier as a reason for that. I'd like my spouse to join the teaching session. That's not a barrier, that's just a preference. I can't concentrate when I'm in pain. All right, pain is the barrier, right? So really we need to control their pain before I can do any real teaching because they can't concentrate. A client states, I feel like my life isn't worth living anymore. What is the nurse's best response? I feel like my life isn't worth living anymore. What is the nurse's best response? Are you thinking of harming yourself? You have so much to live for. Tell me more about what makes you feel this way. Try not to think like that. All right, B and D are clearly not right. Okay, so clearly not right. So they feel like their life isn't worth living anymore. So could that mean they're thinking of killing themselves? It doesn't say they are thinking of killing themselves, but there's certainly an implication there that they could be. And so it is best, before we get into just therapeutic communication, we have to address their safety. So therapeutic communication is really important unless there's a safety need. And if there's a safety need, I really have to address that first. So I would say C eventually. I would say that eventually, but first I need to say, are you thinking of harming yourself? Now, it's also best because if I have to say anything, if I can only say one thing, I have to assess whether they're thinking of harming themselves. I have to do that. I attended online. I attended a Zoom conference with National Council of State Boards of Nursing last week, where they talked about NCLEX, changes to NCLEX. The good news is the 2026 change coming May 1st, 2026 can have very limited changes, very few changes. And I don't know if they're going to change the difficulty level. They didn't announce that, but they'll announce it by December of 2025. So they were talking about, for each question, one of the ways they assess each question is this a safety issue that the nurse needs to know to practice as a nurse? Or what kind of clinical reasoning does this require? And so in this case, it actually addresses both of those. This question addresses both of those. It addresses both a safety issue that the nurse has to know and clinical reasoning. Clinical reasoning says, I know what to prioritize here. Clinical reasoning is all about prioritization, which is why you get so many prioritization questions on your NCLEX. During a therapeutic session, a client with schizophrenia says, I hear voices telling me I'm worthless. What is the nurse's best response? I don't hear any voices. You must be imagining it. Okay, I don't like that answer. You're not worthless. You're a valuable person. Okay, that must be frightening, but those voices are not real. Okay, are you taking your medication? Okay, if I can only say one thing, do I want to say, are you taking your medication? I mean, I wouldn't mind knowing that, but I'm not sure that's the one thing I have to say. So there's a couple things here. So I'm going to go ahead and cross off B and D because those don't seem like therapeutic, because B seems like saying, oh no, you're not worth, like it doesn't matter what the voices are saying, you're not worthless, honey. Well, we need to address the schizophrenic psychosis. Okay, they're hearing voices, and it says during a therapeutic session. So during a therapeutic session, what that tells me is I'm not just meeting them, I'm working on the nursing care plan. So early on, for a psych patient who's got like schizophrenia, bipolar, depression, early on when I first meet them in the introductory phase, I'm going to be very empathetic. But once I'm into the working phase, we need to work on the care plan. So what kind of a care plan would you have for a schizophrenic client who's hearing voices? Well, you would be working on, because schizophrenics can learn they can learn reality, which means they can learn that the voices are not real. See, that's sort of a fallacy that every schizophrenic has to be medicated forever so they don't hear the voices. Actually, the medications that we give for schizophrenics often are not intended to be used long term. What schizophrenics and manics and even severely depressed individuals sometimes have to learn is the voices, or the delusional thoughts, the voices are not real. And so that's what we would be working on during the therapeutic phase, which is during a therapeutic session. So what I need to do is I need to acknowledge the feeling and present reality. That's should be part of the care plan during the therapeutic phase with a schizophrenic. So would it be better to say, I don't hear any voices, you must be imagining it? Because, I mean, that's fine, but I don't know that we say you're imagining it. That doesn't seem very therapeutic. Oh, I don't hear those, you're just imagining it. Or those must be frightening. That must be frightening. To hear voices, like that's acknowledging the feeling. That's a very therapeutic statement. But those voices are not real. Now that's saying, hey, look, I understand it's frightening to hear voices telling you that you're not valuable, that you're worthless. But those voices are not real. Now, would I want to assess whether they're taking their medications? Maybe. But maybe not, because maybe they're not on medications. I mean, maybe we're at the phase where they can understand reality and they haven't been taking their meds, and we're just trying to help them learn reality without taking the meds, because a lot of the meds have really significant side effects that they aren't crazy about. And I may at some point say, B, you're not worthless, you're a valuable person. Like I may at some point say that, but what is the nurse's best response? What's the one thing I have to say? And you have to understand, we are clinicians at this point. We're not just their friends. Like if it was your friend, you might want to say, you're not worthless, you're a valuable person. Like that's totally fine for your friend. But you have to be clinically competent with a schizophrenic client. And that's what they're really asking you, if you are clinically competent during the therapeutic phase with a schizophrenic client. Okay, so that's it. That was kind of a lot, honestly. So it may not, I mean, maybe it wasn't for you. Maybe it was easy. But I hope that was helpful to you. One of the things that a lot of people tell me, at least a lot of my students have told me, is they struggle with just general psych questions, like therapeutic communication questions. They're never sure what the right answer is. So that's what I was trying to help you with. I hope that was helpful. So good luck on your NCLEX. Remember, don't give up. So just to sort of give you a summary, if you're interested, you can shut the video off now if you're not interested in this. But some of the things I learned when I went to that NCSBN conference, just going to give you a couple of things that I learned when I went to that. So the proposed changes to the 2026 RN test plan, which is going to be fully available in December of 25. The overall format and structure is the same. The categories and percentages and ranges have no change. There are minor edits for clarity, currency, and alignment. And there's going to be one new activity statement added to Category 1, Management of Care, one new activity statement added to Pharmacological and Parenteral Therapies, and one new activity statement added to Physiologic Adaptation, but they didn't report what those are. So as soon as I know, I'll make sure I take these out. And then proposed changes to the 2026 PN test plan. Overall format and structure is the same. Client needs, categories, and percentage ranges are unchanged. There's going to be minor edits for clarity and currency and entry-level activity statement updates. One new statement added to Category 1 and two new statements added and one deleted in Category 7, which is reduction in risk potential. So again, they didn't tell us what those categories are, but I'll report it as soon as I know. And just so you know, there are comfort aids that are allowed without having to get a exemption, okay, like a testing exemption. So things like if there's a med you need to have, like if you have to have your EpiPen or your insulin or anything like that, you don't have to get a medical exemption. You just can bring those in. Bandages, braces, casts, cough drops, eye patches, eyeglasses, glucose tablets, hearing aids, inhalers, medical alert bracelets, medical devices. Those kind of things are all allowed without any exemptions. You don't have to get any exemption. And then mobility devices, walkers, wheelchairs, and so forth are all allowed without any exemptions. And then other approved items include earplugs and noise-reducing headphones. So you can take those without having to get any exemption. You can take a face mask or gloves without any exemption. You can bring a handheld, non-electronic magnifying glass without any exemption. And you can bring tissues with you without any exemption. Okay, so those are things that are allowed. So if you've got a stuffy nose, you have to blow your nose, you can take tissues with you. And then there are 2 scheduled breaks during the exam. And what's going to happen is the proctor is going to ask you at these times, do you want to take a break? So at 2 hours after the exam starts, 2 hours after it starts, the proctor is going to ask you if you want to take a break. You can say no. And then at 3.5 hours after the exam starts, the proctor is going to ask you if you want to take a break. Now, the timer does not stop during these breaks. So if you say yes, the timer does not stop. I'm just letting you know. And then there are unlimited breaks throughout the exam. You just have to raise your hand and the TA will escort you out of the testing room, okay? So you don't have to take any breaks. Even when the proctor comes and asks you, you don't have to take any breaks, but you can. Just remember the timer, the exam clock does not stop during those breaks. And then is there anything else I want to tell you about? Just some stuff about how they write the questions, which I don't think is going to matter to you. And then they did tell me, okay, they did tell us that they can have case studies that have 5 people, okay, 5 people case studies, where you'll be given 5 patients. And then the case study, every question determines, every question is about like prioritizing between them. Now, this should not intimidate you, okay? Do not be intimidated by this. All you have to do is use the same prioritization strategies that I've taught you on this channel. So just look at the prioritization videos and those prioritization strategies like expected versus unexpected and Maslow. Those are the 2 prioritization strategies that I've specifically put on here. There are other prioritization strategies, but those are the 2 I've put on here. If you want to know the others, you have to take our review. But those 2 are the ones I've put on here, and those are the 2 you need to prioritize between patients when you're asked about this, okay? So just make sure that you look at those and you're ready for those in case you get a case study where they give you 5 patients and then every question specifically revolves around a different patient. Okay, not a different patient, but you have to choose between patients. So it doesn't revolve around a different patient. It'll be like, which patient should you see first? Which patient's changing condition is most suggestive of hypoxemia requiring priority nursing assessment? So who should you assess first? Question, these are just some that I wrote out myself as examples. Which patient is at greatest risk for rapid deterioration if not addressed first? So again, who are you going to see first? And then which action is the highest priority intervention to take immediately? So that you have to choose which intervention you take first. And then taking action after stabilizing patient B, which patient should the nurse see next? So y'all, the prioritization strategies I've taught you on this channel will help you determine for every single one of these types of questions. It'll help you with that. So I don't want you to be stressed about that. You know how to answer those questions, okay? I know somebody's going to ask me if I'll put a case study like that on the channel. So I'm going to have to ask Mark Klimek if I can. If he says I can, then I will, because we don't give away on the channel what we do, what we charge money for, right? So this is a supplement to what we do. Remember, we're an NCLEX business. And so we don't give away for free on the channel what we charge money for. And so I would need to ask him if I can do that, because currently I do not have a 5-person case study as part of the Next Gen tutoring. So I could possibly put that on here. I'll have to ask him if I can do that, okay? Love you guys. I'll see you later. Have a great rest of your day.